Hi everyone, this video is medial and lateral pterygoids. So we're going to get started with the screen share. This is page 259 in your book. Here we go. All right, medial and lateral pterygoids. I'll get these to be a little bit bigger here. Medial and lateral pterygoids actually do different things, but they are on the inside or interior surface of the mandible, okay? So these are largely not palpable, at least not as a massage student. They are palpable if you use a glove and you go into the mouth and use your fingers on the opposite side of the mandible to work these muscles. However, that's not something that we're going to be doing in class. And it's not something that you are going to necessarily do to your clients in your practice, okay? In fact, the only time you're going to do intraoral massage is if you are working under the supervision of a dentist, someone who is asking you to do this kind of thing for their patients who have TMJ disorder or something like that, okay? But medial and lateral pterygoids assist the mandible in mastication, or assist the masseter in mastication, so we are going to be talking about them. They are pterygoid muscles. So if you know anything about ptera, this prefix also begins the word pterodactyl, and I'm sure you already put that together, but why do pterygoids and pterodactyl start with the same prefix? Or root word, I should say, not prefix. It's the same root word because the P-T-E-R-Y means winged or wing-shaped. And that is what these look like. Specifically, lateral pterygoids look very much like wings. So this basically just means wing-shaped. Okay. So medial pterygoid is really on the opposite side of the mandible from masseter. So masseter is going to be right here. Medial pterygoid is going to be directly opposite it on the inner portion of the ramus of the mandible here. So if we take a look at the origin, medial surface of lateral pterygoid plate, I'll have to show that to you in a second, of the sphenoid bone and tuberosity of the maxilla, that's the origin. Insertion is medial surface of the ramus of the mandible, right? So we still have that ramus of the mandible as part of this attachment. So it is very much like masseter. So let me get my skull here for a second. I'm going to stop the share. And I am going to show you, where is it? The medial pterygoid plate. Medial pterygoid plate. It's actually this one. Medial is this one, lateral is this one. Medial pterygoid plate, lateral pterygoid plate. Okay. There, again, you can't palpate any of that, but it's okay. We'll go back in here. All right. So medial surface of the lateral pterygoid plate of the sphenoid bone. Yes, that's all part of the sphenoid. Remember, the sphenoid makes these wing-shaped pieces inside the skull. And as far as actions are concerned, unilaterally, what they do is they laterally deviate the mandible. So lateral deviation goes like that, so side to side, okay? And it's not one side or the other. It's not like right lateral deviation or left. It's just lateral deviation. Bilaterally, they elevate the mandible. So again, they assist the masseter in elevation of the mandible, and they protract the mandible, okay? So it's not a true synergist to masseter because of this lateral deviation here, but that's only because of its position on the pterygoid plate. It allows you to move your mandible from side to side. And you do this when speaking and when chewing. You actually move your jaw around a little bit instead of just chewing like this, right? Nobody chews like that. I mean, maybe some people do. You probably have seen some of your relatives chew like that, but For the most part, we don't. We chew sort of in an oval shape. We don't just chew up and down, okay? So medial pterygoids assist with mastication in that way. Lateral pterygoids, again, look very wing shaped. So this is where we get the name. It looks like a wing. There. This one actually has two different parts to it. We have a superior head and an inferior head. So right there is the superior head. This is the inferior head. This one originates on the greater wing of the sphenoid and the lateral surface of the lateral pterygoid plate. Okay, so kind of in the same place, but just a little more superior. Okay, a little more superior here. All right. Now, as far as insertion is concerned, we have an insertion on the articular disc and capsule of the temporomandibular joint, okay, as well as the neck of the mandible. This is a really important insertion because it actually inserts directly into the TMJ, the temporomandibular joint. So this muscle, sort of more than any other, can really affect the positioning of the TMJ, which, if one side is tighter than the other, can cause something called a malocclusion, which means a bad bite, okay? In other words, your mandible doesn't quite line up with your maxilla. And this can cause, over time, TMJ disorders, where you get a grinding in the joint itself because the articular disc starts to wear away. So working intraorally like that under the guidance of a dentist actually can be quite helpful for people who have pretty severe TMJ disorders. Probably some of you sitting at home have them, and maybe you're aware of it, maybe you're not. If you hear a clicking or grinding in back near your ear when you chew, you probably have TMJ disorder, okay? Blame your pterygoids. It's not all the pterygoids' fault, don't get me wrong. There's a lot of other factors. But these can be one of the issues. Having hypertonic lateral pterygoids can be a problem. Okay, so what do? Well, laterally deviate. Okay, so laterally deviate the mandible, and it is to the opposite side, but it almost doesn't matter because you go one way or you go the other, okay? And bilaterally, these protract the mandible just like medial pterygoids do. So let's take a look at these here. This is a really wild view. So this right here is master, of course. We are going to click on that and we're going to hide it. We're going to click on the other one and we're going to hide that. Then we're going to click on this and we're going to hide that. Okay, so we have an interior view here. We're going right through. All right. That's kind of weird, right? Let's put that back on. Yeah, good idea. Okay. So what we're looking at here, come on. I don't want that. We'll just fade it for a second. What we're looking at right here is the medial pterygoid. Okay. So right here and right here, those are the medial pterygoids, okay? And these are the pterygoid plates that I showed you on the skull. Maybe you can see them a little bit better this way. These are the pterygoid plates. So this is the medial pterygoid plate, and then you can see that the medial pterygoid actually inserts onto the lateral pterygoid plate or attaches. Okay. And this is the tongue in a weird, I mean, it's just, this is a very strange view. But anyway, these are the medial pterygoids, and then up in here, I got to flip them up a little. These are the lateral pterygoids. Okay, so you see how they're in a different position from the medial pterygoids here. I wish I could kind of take this. Well, let's see if I can fade all of this maybe. So you can see behind there, there's lateral pterygoid, and that one right there is medial pterygoid. kind of hard to see. But from the other side, there's the mandible again, and there's medial pterygoid and lateral pterygoid. Okay, so you see the proximity. This is the temporomandibular joint right here. That's the joint capsule. Okay. Right there. Okay, so lateral pterygoid attaches directly to the joint capsule there. So you can see how close everything is to the temporomandibular joint. Okay, that's it for medial and lateral pterygoids. See you soon.